I'd like to welcome Dr. Judy Wang. She is a tenured associate professor of oncology and a member of the Cancer Prevention and Cancer Control Program, which is part of the Lombardi Comprehensive Cancer Center at Georgetown University. That's a mouthful. Dr. Wang's research area focuses on culture, psychology, and behavioral medicine. She has received research awards from nonprofit foundations and National Cancer Institute to investigate the impact of culture on cancer screening and survivorship experiences among Asian Americans. Welcome, Dr. Wang. We'll hand the baton over to you. You might be on mute.
You're muted.
Okay.
Yep.
So,
Perfect.
yeah.
We can hear
Did
you.
you hear me? Did you hear
Yes.
me? Okay. Thanks, Ms. Gonzalez, for this nice introduction. So this presentation will focus on women who were diagnosed with breast cancer and their quality of life after completing their treatment. So that's we talking about the cancer survivorship. So as you have known, breast cancer is the most common cancer for many women from different cultural backgrounds. While culturally competent care has been emphasized, research is examining that cultural influence on women's adaptation to cancer diagnosis is still limited. So some articles reveal that cancer patients from different cultural groups have different attitude and behavior. So I try to give some examples here. You can find the results from interviewing multi-ethnic women show that Latina and Asian women were more reluctant to obtain the cancer screening or having clinicians touch their private area, such as breast and or cervical exams, as their cultures emphasize modesty. And this study also found that African American cultures values family and spiritual supports. So breast cancer diagnosis might increase African American women's fear for other family members well-being and feelings of disgrace on their families. On the other hand, research also found that their spiritual connections with God strengthen their coping with breast cancer. However, their experience with racism and makes their healthcare utilizations less optimal. And such a cultural influence is real and common in clinical practice too. So a physician presented a case that a hormones patient did not respond to her questions, but kept looking one of the males in the family. They came together to see the physician. So this is because in hormones culture, the eldest males in the family make decisions. So how to incorporate family members' opinion into the treatment decision making is also important for some patients from different cultural backgrounds. So could we go to the next slide? So in the following, I will share my research data presenting the racial differences in breast cancer survivorship between Chinese American and non-Hispanic white women, or I call the Caucasians hereafter. The two, we do the compare the Caucasian and Chinese American because they have a very distinct cultural beliefs and norms. This table shows that they are different philosophies. Chinese culture emphasizes conformity to authorities who have professional knowledge and skills like physicians, whereas American culture emphasizes individual interests and self-autonomy. So we found that Chinese breast cancer survivors were more obedient, even they see the physicians did not answer their questions or were rushed during the encounters. Also, Chinese women put families interests before their own interests, so that they were less likely to disclose their emotional distress to avoid burdening their families. Whereas Caucasian women mentioned that they would like to express their emotion to their family members and close ones to share their emotion together and to support each other. So there are the cultural differences Also, like we are aware of the immigration, like stress. For the majority of Chinese Americans are immigrants. So therefore, many Chinese survivors have limited English ability. And so that makes them harder to find a job, and they were more likely to worry about losing their jobs and health insurance. So, and also immigrant Chinese survivors were less able to afford cancer care costs and no health care information in their neighborhoods based on their reports. So also, like there's a cultural difference is representing in their lifestyle. So we can see the next slide to see the lifestyle differences. So this slide shows that 80% of Caucasian breast cancer survivors adhere to the recommended physical activity level for cancer survivors. However, you can see the right spot, the low acculturated Chinese, among them, only 62% reported they adhere to the recommended physical activities. When we say the low acculturated Chinese, that means they have like a lower English ability in speaking, reading, writing, and listening. And compared to higher acculturated Chinese, they have a better English proficiency and also live in the US over 5 years. So they were behaviorally more assimilated to the American culture. You can see the adherence to the recommended physical activity level is more similar to Caucasian breast cancer survivors. Let's go to the next slide. So this slide, the other one, the previous one. Yeah, so this slide, you can see there were no differences across the next one, sorry. Yeah, you can see the differences across the three groups, like Caucasians, higher acculturated, and lower acculturated Chinese American survivors. No differences in their walking and moderate level of physical activities. The differences is in vigorous physical activity. You can see that 48% of Caucasian breast cancer survivors reported engaged in the vigorous activities, and then 45% among like a higher acculturated Chinese American breast cancer survivor, and only like 14% of low acculturated Chinese breast cancer survivor reported engaged in the vigorous activity. This may be cultural differences because the American culture values like a sports achievement and may engage more in strenuous like physical activities or vigorous activities compared to Asian culture. For those lower acculturated Chinese American, they do not value that much about the sports achievement or engage in vigorous activities. So this can be an implication of a cultural influence on breast cancer survivorship, like a coping through the physical activity. Next. And we can also see like Chinese American have a different dietary practice, particularly soy foods are commonly consumed in Asians like everyday meals, such as like soy milk and tofu related products. And my study found that about like 50%, you can see the green bars, yeah, on the highest level, like more than 24 grams every day. More than about 50% of Chinese American breast cancer survivors consumed a higher level of soy foods. In contrast, only 20% of Caucasians reported a similar level of soy consumption. You can see on the left, like blue bars, there are 42% of Caucasian survivors have no intake of soy products. So that's the cultural differences influencing their dietary practice. Next one. I didn't show the slide here, but we found that soy food intake influence like breast cancer survivors, like menopause symptoms. So we found there's a higher level soy food intake also have a less like symptom, less number of like menopause symptom reported. Okay, for this slide, we show another like a social cultural differences between like a Chinese American and Caucasian breast cancer survivors who have a different stress and coping style. In this table, you can see like a low acculturated Chinese survivor had the poorest like communication quality with physician, and also perceive less control like over breast cancer. So their score lower in communication, in perceived control. Also, they were less likely to use like engagement coping in terms of like they less likely to use like a problem solving strategy. They were less likely to use the planning strategy compared to Caucasian breast cancer survivor and highly acculturated Chinese breast cancer survivor. They also were less likely to have like a social economic well-being. They had they reported less like social economic like support. They reported less health care information, and they also had less like a social support and smaller like a social network compared to Caucasians and highly acculturated Chinese American survivors. Yes. Next one. So you can see as a result, more Chinese breast cancer survivors, 52% of them reported that they had experienced like a fatigue symptoms, compared to like only 35% of like a Caucasians reported like a fatigue symptoms. Next. So therefore, we look for like the physical functioning, because fatigue is a key indicator of physical functioning. You can see the graph shows that low acculturated Chinese survivor had a poorer like a physical functioning. They are 3 points less lower than the Caucasians, and also like lower than the highly acculturated Chinese American breast cancer survivors. And those are 3 points lower is clinically meaningful differences. And so you can see they had like a poorer like a physical functioning. So we are thinking about how we can help these like a low acculturated Chinese breast cancer survivor. Can we go next? We look for like a culturally appropriate intervention to help Chinese breast cancer survivors manage their fatigue and promote their physical functioning. Sponsored by the National Cancer Institute, like R21 research grant, we develop and test a self-administered acupressure intervention. And acupressure is derived in the same theory of acupuncture. And according to the Chinese medicine, we found that the acupuncture and acupressure all try to stimulate like acupoints located near our organs or vessels or tissues in the body. And to stimulate, when you stimulate the acupoints, they send the signals to our brains. And so stimulate our brains to make the brain functions to release the hormones. Those hormones can modulate our stress, pain, energy, sleep, and anti-inflammatory biomarkers. So we then like enroll like 89 Chinese breast cancer survivors who reported mild or severe fatigue, and randomize them to the acupressure intervention group and compare their symptoms and functional outcomes after 6 weeks intervention to the usual care group. And usual care groups means that they are the survivors doing their like a routine care without additional materials or programs provided. Yeah, so you can see the 3 acupoints that we mentioned here. So is one on the hands, and there's a one near the ankles, and there's another one acupoints just under the knees. Yeah, so survivors learn how to perform the acupressure by watching a video. You can see a picture like a physician and the patient here. By watching a video where a Chinese like a medicine doctor introduced instruct patients how to like use their fingers and thumbs to locate and put the appropriate amount of pressure to on those 3 acupoints. And patients need to massage each acupoint for at least 1 minute every day. So each acupoint is parallel on the other side of the body. So survivors can spend like 6 minutes per day, like 3 points on 2 sides of the body. So for 6 weeks, and they record their performance on a daily log every week. So we have the patients like practice the 3 acupoint on both sides of the body for 6 weeks, and each day they only spend 6 minutes. And then we have them to record their practice on a daily log, and we send the RAs who trained by the acupuncturist to check with them in person to see if the breast cancer survivor perform accurately. Next slide. Yeah, so you can see from this is our preliminary findings, and you can see that in the acupressure group, fatigue breast cancer survivors, they increase their like physical functioning. So you see the positive like 3.3 3 points. That means like after they practice the acupressure intervention, we found the changes between the baseline before the practicing the acupressure, and has a 3-point increase after they practice for 6 weeks. So that shows like the acupressure intervention increased their physical functioning by 3 points. And they reduce their depression by 3 points too. So you can see the negative sign, that's 3.1, means that the acupressure group has a 3-point reduction of the depression. They have like a reduction in the other function and symptoms like anxiety, and also fatigue, and that's 11.8 points, and then sleep disturbance, and also pain interference, and increase the cognitive functions. So you can see like in the acupressure groups, they all have a significant improvement in their functional status and symptoms. Compared to the usual care groups, we only see the significant improvement in the reduction of fatigue. Remember that they do the routine care, but they still can do the exercise regularly as they for their preference, and looking for the other intervention as their preference too. Yeah. So we can see the next slides. And so giving the beneficial effect of like next one. Yeah, giving the beneficial effect of self-acupressure in Chinese breast cancer survivor, we propose, and we also found there's another clinical trial shows that its beneficial effects on Caucasian breast cancer survivor. And so we were thinking about if this like intervention can be suitable for to practice among the Black and Latino breast cancer survivor, where many of them experience fatigue, depressive like symptoms, and poor like functional status. So recently we received a National Cancer Institute's community research network at the Wake Forest University's pilot funds. So we have a community member joining us, Nayovida, like and also the Selma D. Jones like breast cancer funds to support our pilot testing of this acupressure intervention in Black and Latino breast cancer survivors. We will also conduct this pilot fund. Pilot study will randomize those like Black and the Latino breast cancer survivor into like one self like acupressure intervention, and also like enhance the usual care arms. We will have them to practice like the same 3 acupoints too, but extend them to from the 6 weeks to 8 weeks, and then we will have them record their performance on the daily logs. And in this pilot trial, we implement one component to have like in addition to the in-personal training, we also have like a 3 like virtual like a training by checking in with them every 2 weeks. Yeah. So we haven't really started this pilot trial yet. We are in the planning stage And hopefully we can show the research result in another probably 6 months later. So hopefully we can share with you more information next. So I would like to conclude the research presentation by giving you some take-home messages. Research has demonstrated attitudinal and behavioral differences in reduction of cancer risk and adaptation to breast cancer diagnosis among minority and immigrant populations. And the input and feedback from patients and community members on the cultural relevance of intervention programs and research materials contribute to the success of research studies. So research-tested evidence is scientifically rigorous in order to assure a safe and beneficial practice in the clinical and community settings. So we greatly appreciate our participants, those who contribute their opinion and feedback, and also our collaborative communities in raising breast cancer awareness through the research and community events. Thank you so much all for contributing to our success in the research work. Thank you.